My name is Jonna Matoizo, and this is my persuasive speech on why everyone should learn CPR. Would you know what to do if someone suddenly collapsed in front of you, no longer breathing and pulseless? Performing CPR on someone who's in sudden cardiac arrest can make all the difference. As a first responder, we are taught the importance of CPR and how it can change the potential outcome. Through this speech, I'll convince you why it's important for everyone to learn CPR and the difference it can be between life and death. I'll further you to learn CPR by illustrating how easy CPR is to learn, how quick CPR is better for brain recovery, and how CPR can help save a life. Learning bystander CPR is relatively quick and easy. According to the New York Times, about 900 Americans die every day from sudden cardiac arrest. Sudden cardiac arrest is when the heart abruptly stops beating, causing loss of blood flow to the brain and other vital organs. By knowing how to react in this situation, you can help prevent another person from this sudden death. CPR can be taught in just a couple of steps, making it one of the easiest life-saving interventions you can learn. CPR is first done by placing one hand on top of the other and interlacing your fingers. Placing your hands on the center of the breastbone, you want to push down hard and fast at about 100 times per minute. An easy way to remember this is by going to the beat of a song. A song that most people use is Staying Alive, as the beat goes between 100 and 120 beats per minute every time you push down. The faster CPR is started, the better it is for the brain to recover. According to verywellhealth.com, after 3 minutes without CPR, the lack of blood flow to the brain can lead to a progressively worsening brain injury. Once the brain starts to go without blood flow, the tissues in the brain begin to die. The longer the loss of blood flows to the brain, the less likely you'll be able to recover from this brain injury. According to science.howstuffworks.com, prompt resuscitation allows the physician time to assess and treat a damaged brain. By using prompt resuscitation techniques, you are allowing the doctor valuable time to help reverse possible brain damage. Without these crucial minutes, the person could be facing a different outcome. With every minute the doctor has is a better outcome for the patient. The sooner you can help, the sooner they can get treated. Knowing how to perform CPR in immediate action can save a life. According to the NCBI, bystander CPR has shown double or triple the chances of survival. By performing early CPR, you are helping the chances of survival while awaiting emergency services. With every minute counts, it is important to do what you can to help initiate resuscitation. NCBI also states that the survival rate of patients in cardiac arrest in public were higher than those at home. This helps demonstrate the importance of bystander CPR, as the immediate action of the bystander can help save a life. It is important to be surrounded by somebody that knows CPR. With somebody that knows CPR, if something were to happen to you or a loved one, they will immediately be able to jump into action and begin the resuscitation efforts. These resuscitation efforts are imperative to getting that blood flow back to the brain and getting that heart pumping again. In conclusion, a cardiac arrest is a life or death situation, and by knowing what to do, you can save someone's life. We have looked at how easy CPR is to learn, how it can help the brain recover from loss of blood flow, and how it can save a life. A cardiac arrest has deadly consequences, but a person can have a positive outcome if they are around a person who knows CPR. Now remember, CPR is easy to learn in just a few quick steps. The sooner blood flow is restored to the brain, the better chance there is for recovery. And by performing immediate CPR in an emergency, you can save a life of a stranger or that of a loved one. By learning CPR, you would know what to do if someone suddenly collapsed in front of you, no longer breathing and pulseless.